what is fracture? A fracture is a partial or complete break in the bone. When fracture happens, it's classified as either open or closed. The open fracture or the compound fracture, where the bone pokes through the skin and can be seen, or a deep wound that exposes the bone through the skin. The latter is the closed fracture or the simple fracture where the bone is broken but the skin is still intact. And these are the types of fracture that may happen: green stick, transverse, spiral, oblique, compression, comminuted, segmental, and avulsion.
Fractures often happen when more force is applied to the bone than the bone can take, and bones are weakest when they are twisted.
Bone fractures can be caused by falls, injury, or as a result of direct hit or kick to the body. Overuse or repetitive motions can tire the muscles and put more pressure to the bone. This causes stress fractures. This is more common in athletes and military recruits.
You should know the situation of the victim first, as symptoms may differ depending on the accident that happened.
Compare the arm from the other arm and see if any of these can be observed: deformity, swelling, bruising, extreme pain, or wound. The person are also experiencing trouble using or moving the injured area or nearby joints, unable to bear weight.
If a person is fractured, you must call for medical help, 911 or your local emergency number. Fractures usually aren't life-threatening, but an immediate medical attention or first aid is a must.
First, don't move the person if necessary to avoid further injury. If there's any bleeding, apply pressure to the wound with clean cloth or sterile bandage to stop any bleeding. Immobilize the injured area. Apply a splint to the area above and below the fractured sites. Carefully place the splint under the fractured limb. Anything that can be used as a splint to immobilize the fractured area. A sling is perfect for this use. Using the sling will also help to immobilize the fractured area and avoid creating more damage by avoiding contact and any form of impact on the fractured area.
And those are the things you need to do while waiting for medical help.
Uncertain things may happen at any time. That is why prevention is needed to reduce the risks. Eat a healthy diet that includes vitamin D and calcium to keep your bones strong. Do not use any form of tobacco as it weakens our bones. Do weight-bearing exercises to keep the bones strong.
Osteoporosis is a common cause of fractures among older people. consult with your healthcare provider about your risk of osteoporosis and get proper treatment if you do have it. Thank you for watching. Remember that safety first is safety always.